Hi everyone, my name is Pat Garish. I work in our inpatient rehab department. I'm going to talk a little bit about body mechanics today and safe patient handling. First thing we're going to talk about in terms of body mechanics is things that you can do to safely lower the risk of injury to yourself and to your patients on the job. So a couple basic parameters. We do have a lot of equipment here that can be used that we'll get to in just a second. We're using a Sprite lift and a Hoyer lift, but first we'll talk about manually moving our patients, the best positions to be in, and safe use of a gait belt, okay? A couple general pointers first. You always want to be lifting with the legs, not with the back. You don't want to bend at the waist and be in that position for a prolonged period of time. Any time that you can take, or any chance that you can take to move a bed or a surface up to bring something up to your own level so you're not bending down, that's going to be ideal for you as well. In terms of a gait belt, so we should be using gait belts with all of our patients when we're mobilizing them. There's going to be a couple exceptions that you might end up holding off on it. That's kind of a rarity. Usually we can end up moving it to a different spot. So in general, what you're going to end up doing with the gait belt is we're going to place that right down around somebody's waist here. And you're going to snug this up nice and tight. Okay? So now, when you're using this, the only time that you're not going to use a gait belt down around the waist like that is if you have somebody that has a midline incision. They might have an ostomy, something that you can't have friction over that or pressure on that site. Sometimes with rib fractures it might be uncomfortable for a patient, so we might want to hold off on that as well. In that instance, you can come right up underneath the arms and place the belt there instead. Okay? So in terms of getting Derek up here, we're going to cue him to scoot forward to the edge of the chair, and then I'm going to come down, kind of bend at the knees here, and we're going to tell him to push up from the armrests here, and I'm going to be holding the back of the belt here if I need to give a little bit of a help. So on the count of 3, 1, 2, 3, up we come. A lot of times too, if a patient doesn't, if they're having a hard time standing, sometimes we might need to just cue them to shift their weight forward a little bit to get the nose over the toes, and that's going to help us get up. Okay. Now in terms of how you want to hold the gait belt, let me just step forward for me. You always want to be right behind the patient with about a 90-degree angle at the arm here. So that way if Derek starts to fall here, I can pull him back like so. If I'm standing too far out behind and he starts to fall, it's going to tear my shoulder out, okay? So we want to make sure that we're nice and close, and you want to guard them if there's a compromised extremity, an injury or anything like that. You want to be on the same side as that, because generally they're going to want to fall this way if it's on the right hand side there, okay? So you want to stay nice and close here and just let them kind of guide along. That's pretty much it with a gait belt. All right, so next we're going to talk about a Sprite lift. So this is going to be really useful. This is one of our pieces of equipment to help with safe patient handling. If you have somebody that's going to require a heavier assist, where you're really exerting yourself to try and get them, patient up from bed or chair to the bathroom, anything like that, or just a bed to chair transfer or vice versa. With this, it's rated to 400 pounds. Generally, what you want to do with this is you don't want somebody to be more than a moderate assistance level, because it's going to get difficult to try and stand the patient back up and clear from these pads here. So if you're looking at somebody that's a heavy, moderate assistance or more, you're requiring that heavy assistance from more than one person, your better bet might be to use either a Hoyer lift or an overhead lift. Okay? So in terms of using the Sprite lift, what we're going to end up doing, so we have Derek sitting in the chair here, we're going to flip our pads up here, and we're going to come forward and place his feet right on the foot pad there, and scoop this in nice and close here. Okay? Now I'm going to lock out the brakes. What we're going to do is we're going to cue Derek again if he's able to scoot forward, but a lot of times those shin pads are going to kind of block. We're going to cue him to reach up for the crossbar here, and on the count of 3, we're going to stand up. 1, 2, 3. Pull yourself up. Good. Now that we're up nice and tall, we're We'll flip these pads down. We're gonna tell Derek to sit down, kind of scoot back against the pads there. We'll unlock. Keep your hands in for the duration of the ride. Roll on over here. We're going to lock. And then we'll cue him to stand back up again. I'll open up the pads. And now we're clear to come back and set.